subscribe now and press the bell icon. Never miss an update.
Hello and welcome to Health Live at Seniors today. We are delighted to have here with us once again Dr. Aditya Agrawal. Those of you who just saw the montage would have seen him also. He's been there on our Health Live shows, perhaps 5 times. He was there on our one of our first shows. And welcome again, Dr. Agrawal. For those of you who do not know Dr. Agrawal, who familiar with him because he's been on our shows in the past, plus he's written for us. Dr. Agrawal is a leading consultant pulmonologist attached to several large hospitals in Mumbai. He's extensively trained in respiratory diseases, both in India and in the US. His special interests are in difficult to treat cough, asthma, bronchitis, lung fibrosis, and he runs a specialized clinic for patients with chronic cough. He's a dedicated researcher and a peer influencer in the management of respiratory diseases. As it happens, May 3rd is the World Asthma Day, and we thought it would be appropriate to have Dr. Agrawal in for this very special session on asthma and its cure for the elderly. We've had a session in the past on asthma and bronchitis, and we thought, given the fact that there are so many concerns that exist with respiratory diseases, and we are in a scenario where there's a fourth wave which is threatening to break in, it would be appropriate to have Dr. Agrawal in for this session. Welcome to Health Live, Dr. Agrawal. How are you?
Thank you so much. I'm great. Thank you so much again. So I'm so excited to speak about asthma today. It's something which I love speaking about. The challenge about asthma is that it's the most misunderstood disease in this country. And the primary reason for this badly understood disease is that we often convert our English language into Hindi or Hindi language into English. Now, we have loosely termed asthma as dama in Hindi. And dama in Hindi means breathlessness. So everybody who is breathless is said to have asthma. And hence, it is often taken as a taboo that if you have asthma, you are done with. You are going to have a life of suffering, of unfulfilled commitments, or unfulfilled dreams, which is absolutely wrong. To make our viewers understand what asthma is, we need to make them understand that asthma is a disease which is chronic. That means it starts very early in life, and you may have or you may not have symptoms of the disease through your life. It's extremely important to understand that asthma, by the very nature, is a reaction of your airways. That means your breathing tubes to something which is noxious, which is difficult to, or rather something which is harmful to your body, which enters your breathing tubes, as a result of which what the airways, that means your breathing tubes, constrict. That means they completely close down. And as a result of which the amount of air passing through these tubes reduces. Because of the reduced surface area, because of the reduced passage of air, what happens is that you have lesser amount of air going in, but also because the mouth of these airways is choked, the amount of air coming out of your lung reduces significantly. As a result of which, air is significantly trapped inside of your lung, which makes you feel full in the chest, which gives you a sensation of heaviness in your chest, which also results in severe anxiety when you are having an asthma attack. And this is the hallmark of the disease. You also may have something like wheezing, which is a whistling sound from the chest. And this is the result of air passing through narrow tubes. So like how you have to, when you want to whistle, you would have to pinch your mouth. The same way you have the airways, when they are pinched or when they are constricted, they will produce a whistling sound, which we call as wheezing. Now, asthma presents in several ways, and it is important to understand that each person may have a different presentation of his or her asthma. Very often, doctors, especially family physicians, tend to shy away from the word asthma and call it bronchitis. Is because of the stigma attached with the word asthma. You may have asthma, but let me, I often have a joke with my patients that if you have asthma, you fall into that 15 to 20% of the population, which is a type A personality population. You are going to be a far better achiever in life than somebody who is not asthmatic, which is again a joke. It's basically to make them understand that their body is far more responsive to environmental triggers into reacting to protect itself. So it's like if something is thrown at you, your first reaction would be to defend yourself. And while you're defending yourself, you will actually push anything which is coming your way. Similarly, when something is trying to enter your breathing tubes into your lung, because of the constriction, you will prevent that noxious thing from going into your lungs. Now, by the noxious things, I mean it could be a draft of very cold air or a draft of very hot air. Like right now, because of the heat wave, we are seeing several patients coming to us with an acute attack of asthma because they are breathing in hot air suddenly and then going into air conditioned or rooms with fans where the air temperature is significantly lower. Now, this variation in temperature is resulting in exacerbations of asthma or attacks of asthma. You may be in a very dusty environment, and this dust, when it goes into your lung, will make your lungs constrict and again cause an attack of asthma. Or it could be a strong odor, like a strong perfume, or the smell of paint. Some patients even have an allergy or they have a response, a trigger to smell of petroleum products. So it could also be several other things such as nail paint remover or strong nail polishes with odor. Now, the list is extremely exhaustive and it would be futile to list everything, but anything which bothers you or which can trigger your airways into going into constriction can result in an attack of asthma. Another very important, or rather two important things, the most common reasons for asthma attack in our population, especially the elderly population, are one, infection, which could be either viral or bacterial. And second is aspiration pneumonia or GERD, which is gastroesophageal reflux disease, that is acidity. Now, how do these two things affect your lung in asthma? Infection increases the inflammation or redness inside your airways or breathing tubes, which results in constriction. And aspiration or GERD, gastroesophageal reflux, that's acidity. When this acid comes up from your stomach into your throat, a small amount of it tends to fall downwards, and sometimes it may invariably go into your breathing tube, that is the airways, which will obviously constrict because of the presence of acid, which is a foreign substance to your airways. That can trigger your asthma attack. Now, it's extremely important to understand when we speak about infections in asthma, it is prudent to prevent any forms of infection. So even before the COVID vaccination became a norm, every patient with asthma was annually vaccinated with the influenza virus vaccine, which is the flu vaccine. And we gave patients who were younger than 65 years of age the streptococcal pneumonia vaccines once every 5 years. If you give two different types of streptococcal vaccines, one is the Prevnar 13 and the other is the Pneumovax, sequentially by spacing them anywhere between 60 days and 365 days, you could actually achieve a lifelong immunity against the bacteria called Streptococcus pneumoniae, which is the most common cause of lung or respiratory tract infections. So if you can prevent lung infections, respiratory tract infections, the vaccines will definitely be very, very helpful. So even if you are not asthmatic but have chronic lung diseases such as chronic bronchitis or COPD or interstitial lung disease, lung fibrosis, or your lungs are inherently weak because of other respiratory illnesses, it is very important that you vaccinate yourself. If you haven't, kindly seek help with your local doctor and have a discussion regarding the vaccines. Now, the COVID has brought about several behavioral changes in our patients. The acceptance of vaccines is far, far better now once the COVID pandemic came by, because now the patients realize that any viral infection can put them at great harm. And hence they started taking the vaccine against COVID. It was very difficult to initially convince our elderly patients or even adult patients into accepting vaccines, because they always thought that this is a pediatric thing where only children are given vaccines, little realizing that there are vaccines which are given at different ages, starting from teenage years till the elderly. And this has really changed a lot of a lot in the medical field. Now, coming back to asthma, how would you know that you have or somebody around you has asthma? Now, asthma is a disease which presents in a variety of different manners. So, the most common symptom or the most common manifestation of asthma is breathlessness. Now, the breathlessness is not constant. You will not have breathlessness all the time. It's variable. It changes from time to time. It changes from morning to evening, evening to night, morning, early morning to morning. Now, this breathlessness is not going to be so significant that you are incapacitated in bed. You may have noticed a little bit of breathlessness when you're climbing stairs, and we call that grade 1 of breathlessness. Or you may just feel that you're walking slower than usual or slower than a peer, somebody your age, gender, and that would be grade 2 breathlessness. If you are so breathless that you have to halt after every 100 steps, you would call that grade 3 breathlessness. And if you are so incapacitated or you are so breathless that walking about in your home or getting dressed or bathing makes you breathless, that would be severe breathlessness. That's grade 4 breathlessness. And I would suggest that if that's the case, immediately seek medical help in a hospital or seek out your medical help by a family doctor. Now, the other symptoms of asthma include cough. And when I speak about cough, the cough would be dry on most instances, or you may have a scanty, very small quantity of a thick, sticky blob of mucus coming into your throat. And the hallmark of this would be that you have to have paroxysms. That means you have to have bouts, or you cough several times before you produce a small bit of phlegm, which tends to stick in your throat or in your mouth or swirl in your mouth. And that's extremely important. Another symptom of asthma is that it may awaken you from sleep. That means you may get up with cough or breathlessness in the middle of the night, or you may have symptoms such as wheezing. Wheezing is a whistling sound, which is usually made in your chest. And with asthma, the kind of cough that you would have, or rather wheezing that you would have, is called a polyphonic wheeze. That means you would have a different timbre of wheezing because different airways, different tubes are blocked at different parts of your lung. The other symptom of asthma would be anxiety. And this would usually happen because of significant air trapped inside your lung, wherein you aren't able to blow out the air because the mouth of the tubes is constricted. Other symptom of asthma, so these are the symptoms of asthma. Now, when I speak about asthma, there are so many different types. I speak about pediatric asthma. That means asthma which starts manifesting in childhood. But then there's a very unique set of patients in our country, which is women between the age of 20 and 30. And This is something which is yet to be explored, but very often women in the age group of 20 to 30 are coming to us with symptoms of breathlessness, which we then diagnose as asthma. There are several different factors which we can attribute this to. One is stress, other is hormonal changes, three is childbearing, and so on and so forth. The other important things that can happen in this age is sudden change in environment or home, and that could be because of different reasons such as traveling for work, traveling for studies, or it could be post-marriage. Then we have often seen asthma in workers. That means that in their occupation. So occupational asthma is the kind of asthma which happens because of exposure to certain substances at the workplace. Now, in a city like Bombay, it may not particularly be factories. It could be just an environment such as an office where the draft of air conditioning um, may cause asthma attacks in certain patients, or it could be because of exposure to certain chemicals. So it could be exposure to certain room fresheners, deodorants, etc. It could often happen because of exposure to pets, animal dander. So to each patient, we have to be able to identify his or her individual triggers. So it's like you have to tailor make the patient's asthma prescription as per his needs and wants. Now, when we speak about asthma, how do you define or how do you identify that somebody may have asthma? The first identification feature in asthma is that you may have a family history of asthma. That means you may have a close family member with symptoms of asthma, or you may have a history of allergies. Now, the allergies may be of different types. You may have skin allergies, you may have eye allergies, you may have allergies such as dry eyes, itchy eyes. You may complain of severe watching of eyes, or a patient may complain of runny nose, stuffy nose, a blocked nose. Somebody, very often children come to us with their parents with complaints of the child snoring, or the child breathing through the mouth all the time, or the child having a foul smell emanating from the mouth. And this is often a result of their tonsils and adenoids because of their allergies. Such patients will often in the pediatric age group come with, a very typical face. The child will have a thin, long face with their front two teeth protruding outwards with a small gap. So these are all subtle signs of an allergic face. Now, child may also have allergies such as food allergies, which may present with gluten allergy, egg allergy, or sometimes even milk allergy. So you have to be able to identify all these factors in a patient when you are assessing one for asthma. So apart from a good clinical history, what's important is that each patient undergo a test called a spirometry, a lung function test. A lung function test has three very important components. One is spirometry, wherein you are asked to blow into a computer through a series of tubes, where we check the amount of air that you blow out in the first second. So as I was explaining to you earlier, asthma is a disease where the tubes narrow, constrict, as a result of which it causes the amount of air flowing out of your lung to reduce significantly. Now, because of the amount of air which you're blowing out is significantly reduced, it means that you aren't able to take in fresh, newer air to replenish the lost or used up oxygen, which results in breathlessness. Then the other test that we do in patients with asthma is something called reversibility testing. That means once you do a lung function test, you repeat the test after a patient has been given inhalers. And as I explained to you, asthma is a reversible disease. Reversible disease means that once you are given bronchodilators, that means medicines, which will open up the constriction, the blockage, you will go back to being normal. So when I explain to somebody that you have asthma, I also explain that it means that if you are medicated right, you will be as normal as anybody who does not have the disease. So any asthmatic should now proudly walk with his head held high, that he will be as normal as anybody and can live his life as normally as all his other friends who do not have asthma. Now, when we do the spirometry with reversibility, that means after we've given a bronchodilator, an inhaler, what we notice is that the patient would have an increase in the amount of air that he's blowing out in the first second. So by definition, asthma should have an increase in the amount of air that he or she blows out in the first second by 200 ml and 12%. So if you are satisfying this criteria, that after the inhaler, your lung, the amount of air that you've blown out has increased by these two particular numbers, then you have something which is called asthma. Then the other tests that we often do are the lung volumes, which help us in identifying certain patients who have air trapping. That means who have air which is stuck inside the lung, which is unable to come out. And now very often we also do the diffusion capacity to understand if there is any other interstitial or any other forms of lung damage. A relatively new test that we are often utilizing today in our clinics is something called FeNO, which is fraction of exhaled nitric oxide. And that helps us in identifying certain types of asthma which would be more responsive to certain types of medicines. So to able to identify which medicine will be beneficial in a patient with asthma is often now determined by these small biomarkers such as FeNO. The other important tests that we often utilize in patients with asthma include a complete blood count, one to identify any increase in the WBC counts, to pick up infections, bacterial infections, or to pick up viral infections by the high lymphocyte counts or the very low lymphocyte counts. And the most important reason why we do a CBC is to identify the eosinophil counts. Any eosinophil count of more than 500 is set to tell us that this patient is going to be more responsive to a certain set of medicines called inhaled corticosteroids or steroids, corticosteroids. Increase in the eosinophil levels helps us in identifying the type of allergic response a patient is mounting or his body is mounting to the noxious stimulus which is affecting him or her. Then the other tests that we often employ are chest X-rays to identify any forms of infection in the lung. Yeah, those are the tests that we often use in asthma. So after we have identified somebody to have asthma, how do we treat it? So once we have identified the asthma, it's important to grade the level of disease. Is the disease mild? Is it moderate? Is it severe? Now, very often you will have, or rather most often you would have patients having only mild disease. And in my practice, I would say 60% of my patients have mild disease. About 20% have moderate disease, and about 10% have severe disease. Now, in real world, most in the population, you would find 70% patients who have mild disease, 20% have, or rather 25% have moderate disease, and only about 5% have severe disease. The reason why my practice would have skewed numbers is because I work in a tertiary care hospital. I probably am at the apex of my treatment of asthma. So obviously, the more difficult to treat asthmas would land up in my clinic, or patients who have not been adequately treated or who have not had adequate response to their past therapies would land up in my clinic. Now, when we treat mild disease, by mild disease, I would say somebody who has very few symptoms, who does not have symptoms throughout the month, the preceding month, or somebody who does not have a very bad spirometry, such patients would be treated with only a combination of a bronchodilator with an inhaled corticosteroid. But the hallmark or the mainstay of treatment would be the inhaled corticosteroid, that inhaled steroid. The reason why we have to use these steroids is because the steroid reduces inflammation. It reduces the redness. It reduces the reaction which the foreign substance has triggered inside your lung. Very often patients and relatives have a concern regarding the word corticosteroid, and they often come and question the side effects that a person may develop because of inhaled corticosteroids. The most important thing to understand is why inhaled corticosteroids are not harmful for somebody is because the amount of dose, the medicine that we are giving, is only between 2 to 5% of what you would need if you were having a tablet of the same steroid. So again, the very low dose does help you. Second, because the disease is inside your lung tubes, that means inside the tubes, you are taking the medicine which is going directly inside your breathing tubes. So it does not have to go through every part of your body to reach the lung. A very simple example, you take the tube, you put the medicine directly into the tube in the form of inhalers, the medicine will go and act immediately. Second thing, you take a tablet, it goes into your stomach, it gets absorbed by the stomach. Not everything will be absorbed. A part of it will be excreted. The part which is absorbed will get absorbed into the blood, which will take it to every corner of your body, from your head to your toe. Only a small part of the medicine which is reaching your lung will affect your lung directly and thus act upon the lung. But even significantly before that, a part of it will pass through the liver, where the liver will metabolize or it will use up and convert the medicine into different digestible products. There you will lose a little bit of more of the medicine. So the total amount of medicine which will reach the lung will be just a fraction of what you are taking. Now, because this medicine has gone to every other part of the body, it will have effects on those parts of the body, which will be undesirable. And this is what we call side effects. So it's important that we give you a medicine in the right formulation. That means we give you a medicine which acts directly upon the intended organ without causing any side effects or harm to other parts of the body. So today, one takeaway should be that inhalers will be your best friends if you have asthma. And you should not challenge the use of inhalers because they will be your best friends. Now, when we speak about moderate asthma, the moderate asthmatics are ones who have more frequent symptoms. That means they may have more frequent attacks of asthma, or they may have more severe symptoms. That means their breathlessness may be greater than grade 1, or that means they may have grade 2, 3, or 4 of breathlessness. They may have more significant symptoms in the day or at night. And patients with severe asthma are those who have to wake up several times at night or wake up earlier than usual because of the asthma symptoms, or they may have complaints of inability to perform their daily activities because of their asthma symptoms, or they may have very poor lung functions on the spirometry and lung function tests. So a combination of these factors will determine how you are treated. Now, asthma can sometimes be a very, very frustrating disease to treat because you have so many variables to identify before you are completely treated. So it starts off with a very good clinical history. That means you have to be able to pick up everything in your environment which is triggering or worsening your asthma. That's one. Identify and eliminate. Once you have done that, you identify how severe your disease is. Once you have classified the severity of your disease and you have started your treatment, just starting your treatment is not equal to getting better. So when you are using your inhaler, the kind of inhaler that you are using, whether you're using a powdered inhaler, you're using an inhaler which comes in little bottles which you squeeze, or you utilize something called a nebulizer, which is now a very, very commonly available thing. And everybody probably knows about nebulizers today after the COVID pandemic. So all these are different ways of just delivering the medicine directly into your lung. You'll have to keep a track of time. I may just overshoot time. So, and when you want me to start questions and answers, please let me know, Mr. Maheshwari.
We could start in the next 2 minutes if you.
All right. So I need to just speak about one very important thing, So now when I speak about asthma being a very frustrating disease, it's extremely important to understand that you may not be able to pick up all the variables. And even if you have picked up all the variables, you may have made an error, or the patient may have made an error in taking his inhaler, or the doctor might have erred in prescribing the right kind of an inhaler or the right kind of medicine. Now, once we are very sure that everything in the past, the checklist have been ticked, that means you have identified and rectified any problem in the past, but still a patient's asthma is still not well controlled, then you look at two things. One, something called poorly controlled asthma despite treatment, or you revisit your diagnosis. Is the diagnosis correct? Because very often you may have mimics of asthma, such as vocal cord dysfunction, where your vocal cords suddenly shut when they should open, or you may have severe acid reflux presenting as asthma, or you may have a heart disease which is presenting with breathlessness and wheezing and cough. And once you have figured out that none of these are present, then you are actually looking at somebody with a very severe form of asthma, which will require the use of inhalers. But today, we are blessed to have 5 different medicines which can be used to treat these severe forms of asthma. I have been lucky to have been able to use these medicines of late, especially because of increased patient education through different media. Better patient education has helped us make patients understand that these medicines will bring them greater benefit. The only challenge is these are expensive, and because most of our patients are paying out of pocket, it becomes a little challenging. However, now a lot of insurance companies are willing to accept even these more expensive medicines for patients with severe asthma. So, in the olden days, it would be, if you don't get better with asthma, either you resign to your fate or doctor kharab hai. So you would change doctors like you change your clothes. Again, that would not really help you, because then you haven't been able to identify your asthma. The other important thing that very often happened in olden days was that patients would go on to take oral steroids for months and years at a time. And when you take the oral medicines, that means medicines which go into your mouth and into your stomach, especially the steroids, will have significant side effects. And today, when I am giving a patient any amount of oral steroid, if ever, I would calculate the total amount I have used in a year and ensure that the patient does not receive beyond a certain amount. Because beyond that, I know that the patient would have severe side effects. So it's important that today we not only consider alleviation of the symptoms, that means making the patient or relieving a patient of his symptoms, it's also important to care for his future health, which was of little benefit earlier. Not many people did that. The other important thing is a very robust discussion with your doctor about asthma action plans, which basically means that you plan ahead of time, that in case a patient with asthma is developing severe symptoms, such as increased cough, increased breathlessness, he or she may not be in a place where he can have access to his regular asthma doctor. So what does he do in such a case? What does he do in such a situation? So a doctor should be able to identify and tell him that these are the steps that you need to follow, and before you seek help from a doctor or before you can reach a medical facility. In this way, you can actually prevent a lot of unwanted medical visits to an emergency room, which is basically getting admitted to a hospital. You would also prevent a lot of unnecessary use of oral steroids. And obviously, your healthcare bills would reduce significantly if you follow these simple advice. Thank you. I'll be open for questions. I would love to answer all the questions that you have.
Thank you very much, Dr. Agrawal, for this session. And we've, we could have gone on, and your points were all, I shouldn't say very interesting, but obviously all much needed in terms of knowledge levels. Those of you who have questions, please ask them. As always, mention your age and your gender. That will help Dr. Agrawal give a considered reply. And ask them in the Q&A tab. That always works better that way. So we have a question by Katie Dadanchi, who asks, should asthma patients avoid eating certain foods and fruits which may trigger an attack? Also, is it okay to eat ice creams and have cold water, or can they trigger an attack?
So again, asthma is a variable disease. Each patient is different. You may or may not be allergic to something. So if you are allergic to a certain food item, avoid it. If you know your asthma is significantly affected by a certain food, avoid it. So usually when I have patients coming in with acid reflux, I would tell them to avoid oily or spicy food while they are having a bad bout of asthma attack. Now, when it comes to cold food or cold water or ice creams, if you have an asthma attack, yes, avoid it. But again, it should be very specific to you. Not everybody with asthma would have a worsened asthma because they have had an ice cream or if they have had cold water. So again, this is a very ambiguous answer. There is no correct answer for this. If you are somebody who gets triggered by cold water, stop having it. Have water at room temperature. If you are somebody who gets triggered by ice cream, stop having it. But if you have had ice cream in the past and it has not affected your asthma, then please feel free to have it.
Great. Thank you. We have a question by Tarun, who asks, and I think we did ask this question in the last session that we had on asthma, is to what extent do good quality air purifiers work towards providing relief? And I remember seeing that in your clinic, you had an air purifier just behind you. So I know you are in Pune today. So do you have an air purifier in the room? Do you insist on the hotel providing you an air purifier?
So yes, the hotel, which I had a pre-requirement of a HEPA filter and the air conditioner in the room where I am. This happens because I am a childhood asthmatic myself. I have had asthma since for as long as I can remember. This is actually genetic. My grandmom had it. And I was lucky that my dad had diagnosed my asthma when I was a little child. And very well treated. I have not used an asthma inhaler in the last 8 years. So if you have asthma, and if you have identified most of your triggers, and if you know how to control it, let me tell you, you may not be hooked onto medicines. So very often we come across patients with the question, doctor, are these medicines going to be lifelong? The answer emphatically is no. You would require your inhalers only till the time your asthma is uncontrolled, and a patient will have to partner with his doctor rather than have the doctor do everything to control somebody's asthma. Now, I see great intent in everybody with asthma getting better, especially with the kind of questions I had. The first two, one, the food which you should avoid, cold things which you should avoid. Very good. And then when you speak about filters or you speak about air purifiers, now, air purifiers actually reduce the total amount of particulate matter in the air. Now, when we live in a city such as Bombay, there is a significantly high amount of particulate matter, which is pollution, air pollution. For me, that's a trigger, but you may be somebody who's not triggered by this. So you may not benefit much from the air purifiers. There is no guideline to say that air purifiers would be beneficial to you. And I categorically say that air purifiers are not necessary. But if you feel that your environment is not as clean, if there is a lot of particulate matter in the place where you are living, then you may use an air purifier. Again, this, please quote me, air purifiers are not going to affect your asthma or better your asthma significantly, but they may definitely improve the quality of air that you're breathing. Air purifiers, if you are going to invest in one, then should have a air purifier, air quality monitor, which tells you the amount of particulate matter in the air. And when you are using an air purifier, ensure that it can cover the volume of rooms that you're living in. So a small air purifier for a very large room will actually be an underkill. And I'm brand agnostic when it comes to air purifiers, so you could choose one as per your budget.
Now, I'm looking at the air quality in place that you live in, Dr. Agrawal, which is Kolaba, and there it is 80. And today I'm looking at Delhi's AQI. As we speak, it is 286. Now, for an AQI of that level, is there a worry about, is it a normal thing to have a purifier? You know, Pune, that the city that you are in today, and I'm looking at this app which is called Suffer. It has an AQI of 103. Now, would you then say that that above a certain AQI, you should take a purifier by, you know, as a normal course without really bothering to ask the doctor?
I can't prescribe somebody to live in a bubble. So when you're using an air purifier, you're only improving the quality of air within the confines of the space that the air purifier is in. Now, we as humans are mobile. We're not in quarantine anymore. We are not holed up in our homes anymore. You are going to travel for work, for different activities. How far can the air purifier take you? So we have to become environmentally conscious citizens. And with the medium of seniors today, I would encourage everybody to start reducing our carbon footprint, start reducing the amount of vehicles that we are using, stop consuming as much petroleum fuel, stop burning stubble, stop burning wood, stop burning leaves, reduce the pollution that you are creating for you, and then again, plant more trees, avoid unnecessary construction. And when you are having any construction at home, try moving away from the home while that construction is happening. So these are simple things that you can do to keep your home clean or your environment clean. The other important thing is unnecessary use of diffusers, unnecessary use of things such as mosquito coils, unnecessary use of incense sticks, candles. Now, you may obviously want your home to smell nice, and that many things can be done to keep your home smelling nice, which definitely does not involve burning of a scented candle or an incense stick, even if it is for religious purposes. Try avoiding it, because all these things will worsen the quality of air indoors and affect your quality of air. So simple things. Plant more trees.
Yeah. Dr. Agrawal, you mentioned about the fact that you had, in your childhood, you were fortunate. And of course, with you were fortunate to have a veteran doctor at home to have discovered the fact that, you needed some help. But obviously, a whole lot of people are not able to figure that they have, that they need medical attention. So at what stage would you recommend going to a doctor in case you do have any or any symptom that that could be asthma?
So whenever you have symptoms of any kind, respiratory, I would suggest you seek at least one consult with a respiratory physician. We often call them pulmonologists also, or chest physicians. A good clinical history would be able to identify a lot of patients with asthma. Um, Many years ago, I, along with a few colleagues of mine, had done spirometries for school children in South Bombay. And we did these studies for children as young as 6 years until 16 years. And we found that 20% of the children in the city had proven asthma. Proven asthma. A majority of them, I would say 80% of them, did not know, or their parents did not know that they may have asthma. Now, when I say that you have asthma, it does not mean that you will have manifestation of the disease or you need to take medicine or inhalers for your asthma. You take treatment for your asthma only when you're symptomatic, and you continue the treatment even if you have no symptoms till the time your doctor tells you that it is safe to be off medicines. And then, even if you are off medicines, if you ever feel that you have symptoms of asthma, go back to taking your medicines, the inhalers.
Doctor, we are almost at 5:45. We're past 5:45. So I'm going to ask a few questions. This is from Manju Agarwal, who is 68. Her question is that she has severe breathlessness, especially while climbing steps. Does Mondeslor TSB have steroids? I'm using Foracart twice a day. Her question is that she has severe breathlessness while climbing steps.
So when you are 68, it's extremely important to not only identify whether all you have is asthma or do you have any other illnesses which can present with breathlessness, which would include diseases like COPD, which is chronic bronchitis, or chronic obstructive pulmonary disease, or is it because of the heart, or is it just weakness and tiredness, or is it just musculoskeletal pain, which is causing pain and reduced movement. So identification of all your problems would actually be with a good clinical history. It's difficult for me to tell you whether all the medicine that you're taking are needed or not. This is not the right forum. But I can just explain to you each thing that you asked for. Mondeslor is Montelukast with desloratadine. Montelukast is a medicine which is given as it's a mast cell stabilizer. It is given when you want to prevent future allergies. Desloratadine is an antihistamine and anti-allergy medicine. It is used to prevent or rather control the allergies which you already have. Foracort is a medicine which contains two different medicines, which is formoterol, which is a long-acting beta-2 agonist, a long-acting bronchodilator, a long-acting medicine which opens up the constriction of the airways. The Foracort also contains a medicine called budesonide in a dose of 200 to 400 micrograms, which is 1/5 of a milligram or 2/5 of a milligram. This medicine is an inhaled corticosteroid which goes directly into your lung and helps reduce the inflammation. That's the best I can do for you in this forum, ma'am. I think you would have to seek a different fora for identifying and, to identifying whether your set of medicines is correct for you or not.
Thank you. We have a question from Sumechan Jain, who says, I'm 80 and his question is, I've been a chronic patient in the past, but not now. Should I continue with Seroflow and Budamate?
Now, Seroflow and Budamate are similar medicines. They both contain long-acting beta-2 agonists and inhaled corticosteroids, just the different medicines. Seroflow or Seretide contains salmeterol fluticasone, whereas Buramate contains formoterol burisinide. Um, it will completely depend upon your level of asthma control. It will depend upon your symptoms, the frequency of your symptoms, the severity of your symptoms. It will also depend upon how bad your lung functions are. If you are somebody who has very frequent symptoms, or somebody who has had symptoms in the recent past, or somebody who has poor lung function, then it would be imperative that you continue your inhaler as prescribed by your doctor.
Right. We have three more questions, Doctor. One is from DJA Santa Maria, who is a singer and who says, uh, the reason for my jam nutrition tube, which started with my humidifier due to COVID, he feels better with a slug of histamine or a quarter of cetirizine, which helps for a while. Mainly going out to nature helps. What should I be doing at this point in time to be back to normal? He says it affects that his singing at high note. Should I call it an allergy or just ignore? There is no breathlessness, only happens only when he sleeps on his back.
So I don't have an answer to that actually. If it's happened post-COVID, then it will depend upon how severe his COVID was. Uh, a lot of other things can happen. He may have that hoarseness of voice. He may have difficulty singing at a higher pitch because of some form of damage to his vocal cords. Um, Now, I cannot comment upon his medicine right now because I haven't seen the patient, and without seeing one, it will be injustice to the patient actually. Um, I would like to see or hear from you later. You can always take my phone number and we can have a detailed conversation about the details of your medical history, sir.
Right. Thank you. I agree. If there are specific queries, you can uh, consult Dr. Aditya Agrawal directly. I will mention his coordinates at the end of this session. In fact, I could ask you for your connects which are at your clinic at Opera House. We have two more questions. One is from Mr. Vijendra Kumar. He's 77, based in Mumbai. He says he's had an angioplasty done twice. My ejection fraction is 45. Since lungs and hearts are functioning interconnected, can the heart function be improved by strengthening lungs? And if so, how can one go about it?
So your heart function will not improve by improving your lung function, but your functionality, that means your ability to perform physical tasks, would definitely improve, because then once your lungs are working better, you will breathe in more air, in effect, more oxygen. Your heart will have to pump out lesser amount of oxygen, or if the pumping of the heart will become more effective. That means for lesser amount of work done by the heart, your body will receive the adequate amount or the needed amount of oxygen. It's extremely important to understand that if you have any chronic respiratory diseases, any chronic lung diseases, or heart diseases, exercise and graded exercises are the mainstay of treatment. It's not just medicines. It's just not what you consume in the form of inhalers or tablets or syrups. It's also that physical activity which will determine your quality of life. And if by medical treatment you are seeking good quality of life, then ensure that you have rehabilitation incorporated by your doctor. Today, when I speak about patients with COPD, that means chronic bronchitis or emphysema, or even patients with lung fibrosis, apart from writing the medication, the most important thing that I do is I enroll them in a rehabilitation program, which ensure that they are increasing the strength of your respiratory muscles, increasing the strength of the muscles, such as the muscles of your arm between your shoulder and your elbows, and the muscles between your hip and your knees, such that the normal basic activities, such as getting in out of a chair, getting up and down, up out of a bed, is not an arduous task, or lifting a glass of water or feeding yourself is not a task. or dressing up is not a task. So if you strengthen your muscles of breathing and the proximal muscles of your limbs, you will actually improve your quality of life.
Thank you, Doctor. We have a question from Shivaji Gavre, who says, I'm 75. Every day I wake up at 5:30 a.m. I exercise from 6:30 to 7:30 a.m. During his exercise, he has to, get rid of his cough every 10 to 15 minutes. And he asks for advice. What should he be doing?
So now, it's important to identify why you have that early morning cough. It could be because of an infected sinus. It could be because of allergies which are caused in your bedroom because of, say, dusty mattress or dusty linen. It could be because of the uncleared or uncleared air in the room. The filters of your air conditioners probably need some servicing. It can happen because of diffusers, perfumes, room fresheners, etc., which you have used in your room. It can also happen because of the very nature of the disease, such as COPD or asthma, what you have. So I won't be able to give you a specific answer, but once you have sorted these problems out, the amount of phlegm that you're producing will significantly reduce.
Thank you very much, Dr. Agrawal, for this session. We normally have our sessions for 40-45 minutes, but this has gone on for an hour. And we could go on and on this topic because there are so many questions that exist, and you have been able to address them very well. I have put Dr. Agrawal's coordinates on the chat window. It is his email address is there, which is adiagra@gmail.com, and his phone number is 022, which is Bombay 23664455, and he is available at the Bombay Hospital from 8 a.m. to 11 a.m. and at his clinic at the Opera House Clinic, which is from 2 p.m. to 8 p.m. You have a very long day, Dr. Agrawal, 8 a.m. to 8 p.m. Is that something that you recommend to people? You have such strenuous hours.
I am passionate about the work I do, especially asthma. And it's actually a lot of fun. So I actually play for those 12 hours.
Play, there are various games that people have. But I agree with you. The passion is visible. And thank you very much once again, Dr. Aditya Agrawal, for coming in, for accepting our invitation over and over again. And we would love to have you once again at some time. As you know, those of you who are regular here, I did not ask that question on COVID, which I normally ask all doctors who are here. And Dr. Agrawal has been on our session a few times for COVID itself. He has written for us on that. But we all know what it is. So mask up, maintain hand hygiene. Yes, it's a problem. It's there, but it's not yet the fourth wave. So take care, all of you. And thank you once again, Dr. Agrawal, and to all the attendees here. We will be back once again next Saturday at 5 p.m. with a session which is going to be different from some of the sessions that we've had. It is going to be on alternative medicine. We have a medical doctor who is going to be talking about acupuncture and the like. So more about it, we will be there. Those of you who are regulars here, and those of you who want to be alerted about our health life sessions, please ensure that you inform us. You fill in the form that you'll find on the chat window right now. Please fill in the form, and we will inform you as soon as we have confirmed with the doctor about the session that is there. So you can inform us. You can keep yourself informed without really having to register every time. Thank you once again. Thank you once again, Dr. Agrawal. Have a good stay in Pune, and we'll be back again next week.
Thank you.
subscribe now and press the bell icon. Never miss an update.